Good morning. I'm Mohammed Masalha. I'm a clinical hematopathologist. And today I want to talk about the complete blood count lab test, or which is known as the CBC. This test actually is very important. Okay, it's a very cheap one. It's a very quick and can provide us with an important information regarding the health status of the patient. For example, we can know if the patient has an anemia or he doesn't have an anemia. Some people may ask, what is anemia? Anemia actually is a low hemoglobin concentration or low in the number of the red blood cells. And the red blood cells are the cells that use to carry oxygen from the lung to the whole body and vice versa. We can have a hint about the type of anemia. Okay, we cannot be sure what caused the anemia, but we can have a quick information, or we can expect some of the causes according to the information that provided by the lab, by the CBC test. We can know also if there is an infection or no, and we can know that by the increase in number on the white blood count. Because if there is an increase in the number of white blood count, we can think, or we can think more about there is an infection. We can also think about an autoimmune disease, because autoimmune diseases can rise those white blood cell counts. The white blood cell counts, or the WBC, actually are the cells that used to fight viruses, to fight bacteria, to fight cancer. So they are very important in the defense mechanism of the human body. Also, we can know from this blood test if there is a cancer or a leukemia, or which is the term used for the cancer of the blood. Leukemia is a broad term. Okay, it's a broad term. It's not just translated into leukemia of blood, because we have a lot of types, a lot of subcategories, a lot of morphological variation when you use the microscope to diagnose the type of leukemia. Another important information that we can know from this blood lab test is if there is a disease of the platelets. Platelets are parts of the blood. They are their main goal is to prevent bleeding when you have a cut in your skin or any internal bleeding. So if we have problems with the platelet, you can find that these patients, they have an increased tendency toward bleeding. So all of this information, they are quick information. They are not detailed, okay, but actually they can give us a hint about the status of the patient. Thank you so much.